Hey everyone, it's Wednesday, time for Wisdom Wednesday. I thought that since it's the first part of the year, we might just sit back and revisit an overall global view of how we might want to approach our health for the coming year. And of course, anything that we do, I kind of try to keep in pillars of health. When I approach even just new patients, we look at what I consider the 5 major pillars, which are nutrition, diet, nutrition, and supplements, exercise, sleep, stress management, and hormones. And in and amongst all that, of course, is optimizing our immune system. So I thought I would just review for you what I recommend as far as just helping. If you start to feel like you're getting a cold or flu, we don't just know that the last several weeks to really the last 6 to 8 weeks has been fairly rampant with viruses. We've got RSV, we've just got the cold virus, we've got COVID out there, and of course flu. And it's helpful to optimize the immune system. Of course, we're getting past eating all the sugar and all the alcohol from the holidays, so hopefully a lot of this will calm down, but it does make us more susceptible when we are not eating and drinking like we should, and just makes us a better target for all these viruses out there. But just in general, just to review, for the week, if you start to feel like you're getting a cold or flu or a little sore throat, whether it's a common cold, flu, or COVID, or any of those kinds of things, kind of the same thing, just to boost the immune system and help the immune system fight this. So for 1 week, every day, I want you to take 10,000 units, international units of vitamin D3. Next, I want about 5,000 of vitamin C. Now, it's really challenging to get all of that vitamin C at once and not have your bowels kind of give you a little kick and increase looseness within the bowels. So what I recommend is doing 1,000 every couple of hours throughout the day, so that you can try to get 5,000 milligrams of vitamin C. And whether you do emergency in water or just take some tablets or capsules, that's fine, but you want to spread that out throughout the day. So you want about 10,000 international units of vitamin D3, you want 5,000 milligrams of vitamin C, and then anywhere from 20 to 50 milligrams of zinc, which can be very helpful as an antiviral mineral. And with that, you want some quercetin. And quercetin, about 500 or 600 milligrams twice a day to help. It's called a zinc ionophore. It pushes zinc inside the cells so that it inhibits viral replication. Now, if you have COVID, there's some interesting data about using histamine blockers, a histamine 1 blocker and a histamine 2 blocker. So histamine 1 is utilizing the Zyrtec or Claritin, Allegra, any of those can be helpful. And then the histamine 2 blocker is Pepcid. And for some reason, there is some interesting data that can also help eliminate some of the symptoms if you should get COVID. So I would add that on just for COVID. And of course, there's Paxlovid out there for those of you who feel like that might be of some benefit. And many people have done very well on that. Other people have a lot of side effects. So that's kind of a individual basis of whether or not to use the pharmaceutical Paxlovid for COVID. As far as just all the other things that we want to look at, we would like to try to just set up kind of a game plan for how to optimize our nutrition and supplements, which we've talked about kind of ad nauseum. But one of the things that's kind of helpful this time of year to consider would be to look at just a program, a 30-day elimination program. One of the best ones and easiest ones out there, and certainly the one that's probably most known and so much free material online, is Whole30. That's WHOLE, Whole30, a whole 30 days of elimination. And there are so many great apps and websites and certainly just books and data and information available with that program. But it's basically an elimination diet to calm the system and just a reset. And there are lots of other detox programs which are fine. to do something like that. If you do a 5 or 6 day detox, that's perfectly fine to do. It's all about just giving your body a break and rest and sort of a way to let it come back to baseline. So that's a really nice thing to consider as far as diet and nutrition. Obviously, we've talked a lot about trying to minimize carbohydrates for those of you that are trying to lose weight. It's about controlling insulin and understanding how insulin can be powerful and is important for trying to manage metabolism, metabolic panels, and things like that, in addition to trying to control weight. And if you've got that extra 5 or 6 pounds, if you'll just eliminate a meal, you might find that you can get that taken care of fairly quickly. So that kind of covers diet, nutrition. The supplements we've talked about just from an immune standpoint, but in addition to that, just from a baseline standpoint, we want a good multivitamin, fish oil, a B complex, probiotic, that vitamin D, and then we use magnesium at bedtime too. So if you have any questions about that, we certainly can help you with that, just getting on a good basic pack, morning and evening, etc. Now, as far as exercise is concerned, data is continuing to come out in so many different areas. You know, in the past year, we've talked a lot about not having to kill yourself at the gym. We know that when you build muscle, it's the day after you work out, so you don't have to do something every single day. But exercise is very valuable. And even if you are a minimalist, just 10 minutes a day of walking can be very powerful as far as longevity and health and wellness and metabolism is concerned. So just consider a 10-minute walk after one meal a day. And that should really, at least if you are someone who just does not like to go to the gym, if you don't want to do a lot of muscle work, then you could do that. The other thing I think really are resistance bands. And again, you don't have to be a member of a gym. You don't have to have a trainer. These are things that you can do on your own. Sleep, of course, is vital. We've talked a lot about that. So we encourage good sleeping habits, good sleep hygiene. If you need help with that, we are certainly available. And we know that there are stressors that can play a role in sleep and stressors that play a role in inability to lose weight and to get healthier. So understanding the importance of stress management can be exceedingly valuable. Deep breathing. So just learning how to do that good 4-7-8 breath or any kind of box breathing, all of those things, just expanding your lungs so much more. In our general world, we just tend to breathe fairly shallowly and we don't really expand our lungs, which then expands the diaphragm and gets that vagal nerve, that part of our nervous system, which is the autonomic nervous system, which is our parasympathetic tone, our calming side, our rest and digest side, is very helpful. And just from an eating standpoint, not eating every 2 or 3 hours, trying to have those time restricted eating periods so that we don't have to overwhelm that digestive system. And then of course, in our world, lastly is hormonal balance. And we do quite a bit of that work, as you know, and we're always available to help you in that area, trying to help balance hormones. But even if you just do those first 4 things, diet, nutrition, supplements, lifestyle benefits there, the exercise, getting good healthy sleep, and stress management, you're going to go a long way, even if you don't consider doing any hormonal replacement type therapy. So just as you look ahead in 2024, if you'll think about these 5 particular pillars and think about them each day, even if you just take a minute every morning to kind of look at your day, visualize your day, and see where you're going to really set forth your goals and your plans for the day, you will find that you're going to be able to reach those goals so much more clearly if you really make that effort. If you just leave it to chance, it's just not going to happen. We know that. So be mindful and stay on task and make it fun and make it easy, make it sustainable. Don't set yourself up for failure. Don't overset your goals, but be very realistic. Try to do one thing at a time if you really are trying to make those changes. We talked a little bit about atomic habits last week and trying to make really good habits. So be realistic and set yourself up for success. Hope you all have a great week, and we'll talk again next week.